everyone. We are the nurses from Far Eastern Memorial Hospital 60 Ward. Now, we are teaching you to help patients get up and down from the bed. Benefits of getting out of the bed. Helps patients who have had prolonged bed rest to get out of bed in order to exercise boost their lungs' ability to clear secretion, increase muscle strength, and prevent complications such as muscular degeneration. Precautions. Before getting out of the bed, slowly raise the head of the bed. Let the patient sit up. Observe if there is any dizziness, and then help patients out of bed. Keep the movement slow before and after getting the patient out of the bed to prevent orthostatic hypotension. Keep an eye on the patient's expression, color, and changes in skin to prevent any dangerous situations. Patients should not get out of the bed immediately after feeding. Help the patient get out of the bed 30 to 60 minutes after feeding to prevent vomiting. When assisting the patient, avoid pulling the tube. Patients who use a urinary catheter need to prevent urine backflow when getting out of bed. Watch out for patients' safety in a wheelchair and provide necessary support. Use straitjacket, bed sheet, or pillow to ensure stable position of the patient's body. When the caregiver assists the patient, avoid bending down and using leg strength. Help the patient get back to bed from the wheelchair. Place the wheelchair 45 degrees from the bed. Put the brake on and move the footrest out of the way. The caregiver puts one of his legs in between the patient's legs and bends his knees. Reach around the patient's pants and put the patient's hands on the staff's shoulder. Hold the patient's body forward and up, and gently use feet to stand on the patient's feet in order to turn the patient to the bed. Complete the above to assist the patient to go to bed. Help the patient getting into wheelchair from bed. Place the wheelchair 45 degrees from the bed. Put the brake on and move the footrest out of the way. Help the patient sit up by the side of the bed. The caregiver places one foot between the patient's leg and squats. The patient rests her hands on the caregiver's shoulders, and the caregiver grabs the patient's trouser with both hands. Hold the patient's body forward and up, and gently place feet on the patient's feet to turn the patient to the wheelchair. Slowly sit the patient into the wheelchair. Put down and footrest, and release the brake. Complete the above to assist the patient to the out of bed.